radiation worker has received. All these things can be calculated. Now see how they are. Now whatever is a black pocketed material is sent to the laboratory. It comes with the name of a technician and it is returned to the laboratory where their indexing is done, where that calculation is done to know how much radiation a person has received. Now storage of TLD batches, I told you, unless we keep it properly, unless we take proper care of them, they will not give us a sensitivity good enough to get very small amount of radiations. Now batches must be left in an area where it could receive a radiation exposure when not borne by the individual. So a batch should not receive radiation when it is not worn by a particular person. The storage is in a dark area and it doesn't have a radiation background. Then lost or damages should be reported immediately to the radiation safety officer and a replacement batch should be issued. This is done by a RSO, that is radiation safety officer, who sends it to the laboratory and gets a fresh one. Then dose limits of AERB. The limit of effective dose applied to some of the effective doses from the external as well as internal sources. The limit include the exposure due to natural background radiation and natural background exposures. The calendar area shall be used for all the prescribed dose limits. Then we are talking of the occupational exposures. An effective dose of 20 MSV average over 5 consecutive years. If it is less than that, be happy. An effective dose of 30 MSV in a single calendar year is again a warning that you are exceeding a radiation dose. Then equivalent dose of lens of the eye is 150 MSV per year that should be borne. Otherwise, they will be susceptible for premature cataract. And equivalent dose of extremities will be giving you very shortly. It is higher but should be borne in mind. And the equivalent dose of skin is around 500 MSV. See, it was average 20, lens was 150, and maximum equivalent dose to the skin is, so skin has got maximum tolerance to the radiation, or it is less sensitive to radiation. Then what is the rule for apprentice and trainees? The occupational exposures of apprentice and trainees between the age of 16 years to 18 years of average shall be so controlled that the following limits are not exceeded. A RSO has to take care of it. A radiologist has to take care of all these things so that those apprentices who are coming new to the department are protected. An effective dose of 6 MSV per year is fixed for them. Then an effective dose of lens should not be exceeding 50 MSV. Then effective dose to the extremities should be within 150 per year. The unit is MSV. Then effective dose to the skin is 150 MSV per year. Now what is the rule for the mobile population, moving population, or the population outside the radiation unit? There may be offices, there may be some business centers. The effective dose of 1 MSV should be allowed to them, not more than that. The effective dose to the lens of the eye, we are talking of the members of public, not radiation workers, is 1.5 a year. It's a cumulative, so it will get spread over the long duration. Then the effective dose to the skin, 50. So it's less to the people who are outside the radiology department, those who are not regularly exposed. So let's come to a conclusion. Protect patient, protect people, protect staff. Remember, dose of cumulative. If you receive a dose of radiation today, which is excess, it is going to remain throughout. So you have to take care of it. But the advantage is it will get spread over the multiple years. You have to weigh what are the benefit. You have to weigh what is the risk of that. And this ratio of benefit versus risk should be calculated. Principle of radiation protection are extensively covered, which follows inverse square law, which gives you a hints how a radiation should be avoided or minimized. Then dose reduction should be used, like reduction in time. You use short time so that the radiation will be on for a shorter time. Then distance, that is inverse square law try to keep away as much as possible yourself. Then shield whichever are the sensitive areas, like thyroid shields are available, then gonadal shields are available, lead apron you are wearing. Then also there are lead goggles which protects you from your eye from the radiation. Now what is recommended? Shield thyroid and gonads, always wear lead apron. Repeatedly we are saying, because the important thing, and it should be kept in mind. Measure the radiation you have received. See the cumulative dose till now, and then take the preventive measures. CT scan, often there are a lot of exposures. There are thin sections. So it should be justified. Whenever essential, you must do it. But whenever not necessary, just for the purpose of experimentation or for the purpose of the follow-up, they should not be done unless they are indicated. Patient education is important. There should be a universal X-ray bank where patients' X-ray can be accessible whenever from the hospital. Now this concept is coming. It is like an ATM that you can access it from anywhere. You get your data